phase in which individuals get attracted to persons of the opposite sex. So romantic relationships are also something which are a very, very important thing to consider at this particular point of time. And frequently we find that persons with disabilities may be denied these very, very natural and very important human experiences. Now, with regard to higher education and employment, we see that there is a lack of access to higher education and employment opportunities for persons with disabilities. This is globally the case, and also in India. We've spoken earlier about how access to school education is also a big problem. So if a child is not able to go to school and complete their school education, then how are they going to access higher education? And because they are not educated, they do not have access to education, training, and so on, obviously their employment situation is also affected. And this leads to what we refer to as a long-term dependence on the family. So the family also may look at their disabled person as somebody who is going to be a permanent dependent, that this person is never going to earn, this person is never going to be independent. And this leads to even more of a kind of a mental conflict and mental torment for the individual with disabilities. Also, the barriers that we've spoken about earlier, the physical, attitude barriers, communication barriers, technological barriers, these are all very much a part of the experiences of adolescents and young adults with disabilities. Now, there is a term called reasonable accommodation. Now, as per the law, the Rights of Persons with Disabilities Act, reasonable accommodation is supposed to be provided to individuals with disabilities. So, for instance, if a person with disabilities is going to a higher education institute, a reasonable accommodation would be to schedule the classes that he or she takes on the ground floor so that they do not have to climb up the steps. So many reasonable accommodations can be done, which can really help individuals with disabilities to access the wider world. But unfortunately, there's very little awareness about this, very little knowledge about this by the various institutions as well as by persons with disabilities themselves. So this is a major factor that needs to be taken care of. To sum up what we have been speaking about so far, so to understand the experience of disability in a more holistic manner, it is very, very important to study it across the life course. Children with disabilities must be nurtured and valued. Like all other children, they too have the right to a joyful childhood, which is filled with rich and diverse experiences. This will enable them to negotiate the various challenges of adolescence and identity formation more effectively. Adolescents and young adults with disabilities need support as well as autonomy so that they develop a positive self-concept. So basically, learners, what we've spoken about in this session are two very, very important life stages in the life of any individual, which is childhood and adolescence. And the various kinds of stigmas, stereotypes, negative perceptions, etc. around disability that affect the lives of children and adolescents need to be taken very, very seriously. And there is a need for a lot of awareness on the part of families, awareness on the part of professionals, awareness on the part of the medical community, awareness on the part of society in general to understand that disability is just one type or one form of human difference. It is not something that should be regarded as a disaster, a tragedy, something terrible. Persons with disabilities can and do lead very, very fulfilled and happy lives. However, one of the other very, very important things that it is a must for us to say is that when poverty and disability are correlated, many of the conditions that are preventable, so for instance, because of poor maternal nutrition, poor care of the newborn child, many disabling conditions can be prevented with proper development, with proper access to medical and social security and medical and social development. So these are some of the very, very important things that we need to bear in mind. And with this, we will end this particular part of the session. And in the next session, we will be talking about the next two important developmental stages of our lives, namely adulthood and old age. Thank you.
आप सभी को नमस्कार। मेरा नाम मंजू सनवाल है। आई एम अ PhD in distance education. It was a very good journey. I enjoyed this journey very much. But besides enjoyment, there was many up and downs also. You can say हम उस एरा से हैं जबकि टेक्नोलॉजी का इतना अधिक यूज़ हम लोग इतनी इजीली नहीं कर पाते हैं। तो कंप्यूटर यूज़ करना, टेक्नोलॉजी यूज़ करना, ये एक बड़ा चैलेंज था ड्यूरिंग PhD मेरे लिए। आप लोगों के माध्यम से उन सभी लोगों को थैंक यू कहना चाहूँगी जिन्होंने इस जर्नी में मेरा सहयोग दिया, जैसे कि मेरा परिवार, मेरे बच्चे, मेरे गाइड और मेरे कलीग्स।
My name is Dr. Jyoti Sharma. I have done PhD in management from School of Management Studies. There were some challenges because I was away from the center and my guide was here. But now because of the technology, it is easier to communicate with your professors. But in between, I had some personal challenges also, and I had joined this journey when I was already 57 years. So yes, it was slightly difficult for me at this age because I had some personal challenges. But it was such a long learning process. I think I have become very mature. I have developed more sense of perseverance here. So I'll request anybody who is self-motivated and who has perseverance to start this journey. But then it has to be brought to a logical conclusion. Thank you.
And I'm a PhD scholar. I have recently completed my PhD in psychology. And मैं ये कहना चाहूँगा कि सबसे पहले तो मैं IGNOU का शुक्रिया अदा करना चाहूँगा because I was working in a government sector and it was not possible for me to go for a regular, full-time PhD. So IGNOU gave me an opportunity to go for part-time regular PhD, and that helped me to achieve my dream. In terms of my journey, it was a very good journey and it was fruitful and I learned so much out of it. And there were many challenges as well, for example, in terms of data gathering and sampling, because the topic which I had chosen was a bit sensitive. Well, my PhD topic was existential concerns, shattered assumptions and alienation in relation to exposure to violence amongst Kashmiri youth. I'm thankful to my guide as well, who helped me all the way, and all the faculty in IGNOU that helped me a lot. So that made my journey easy, and as I said earlier that it was not possible for me to go for full-time PhD because of my job constraints. So IGNOU gave me an opportunity, so a big thanks to IGNOU.
Hello learners, welcome back to the second part of our session in which we are discussing disability through the life course. In this session, we shall talk about the two stages of adulthood and old age. So let's begin by discussing adulthood in greater detail. Now, as you know, adulthood is a period in an individual's life which brings a number of responsibilities as well as rights. Adults are supposed to take care of their own needs as well as the needs of their dependents, their children, and so on. So when this happens, we find that adults are really in a situation where they can make their decisions and their choices about where they have to go for a higher education, where they have to go for employment, and so on and so forth. So this is extremely important and needs to be addressed in greater detail. But when we speak about adults with disabilities, we find that this phase of adulthood becomes very, very problematic for them because the rights, the duties, the responsibilities that are allocated to persons without disabilities are usually denied to them. And let's speak about this in greater detail. What are some of the challenges of adulthood? So the normal adult roles are often denied to persons with disabilities. We find that there is a tendency to view them as permanent children, to be in the care and the protection of their families or in special facilities. Many of them, we find, never receive an education, they never receive training, or they may be unemployed and underemployed throughout their lives. And as a result of this, they are not able really to access the benefits of having a full-time job, having an income, and so on and so forth. Marriage and setting up a family of their own may also be filled with challenges. Adulthood actually sees the development of autonomy and independence, where new responsibilities and transitions take place. So, for instance, an individual may travel to another city to pursue a job, or may travel to another country also. An individual may be transferred because of professional requirements. But in the case of persons with disabilities, many of these opportunities may be denied because of their disability. So these are things that really need to be spoken about, they need to be addressed, and solutions need to be found for them. Now let's talk about one of the very, very important aspects of adult life, which is marriage and family life. Now, we find that when it comes to marriage, there are a lot of misconceptions about persons with disabilities and marriage. It is often believed that a person with disability is incapable of getting married or having a family. It is frequently thought that they may not be able to look after families, they may not be adequate husbands or wives. In the case particularly we find of women with disabilities, it is assumed that because a woman is in need of care herself, it will not be possible for her to be a caregiver, it will not be possible for her to take care of a young family. In the case of men with disabilities, it is thought that they will not be able to provide for their families, they will not be good breadwinners. So there are many such conceptions, or there are many such beliefs about adults with disabilities, which in many ways can really impact their life chances of leading a regular kind of a life. We find that adults are supposed to take care of their own needs, but because it is believed that they are so dependent, or because they are dependent on their families, they will not be able to take care of their own needs in adulthood. And therefore, this concept of looking at them as permanent children is something that is very, very pervasive. We find that there are many adults who may have very severe kinds of disabilities or certain kinds of disabilities for which they need lifelong care. These are what we call high support needs. And because of a lack of social security mechanisms, very often families find it very, very difficult to do the long-term care or to address the long-term care needs of adults with disabilities. Lack of financial independence is one of the very, very important factors that needs to be spoken about. We've discussed in the earlier session also how employment, how education are basically issues and challenges. So there are many persons with disabilities who never get a proper education and therefore don't get employment. Those who do get employment usually get work which is very low paying, which is not work that is extremely prestigious or through which they can rise very high up in the employment ladder. And therefore, it may lead to a situation of them not really being financially independent or financially stable. Another important fact that we need to talk about is very often when persons with disabilities or persons who did not have disabilities become disabled during the course of their employment, very often they may be terminated from their jobs. So if a person loses their sight or their mobility or any other of their faculties while being an employed person, it is very possible that they will not be able to get back to their jobs, or they may be given jobs which are not commensurate with their training, with their abilities, and so on and so forth. And therefore, this can also lead to a great deal of financial insecurity and instability. Now, persons with conditions like intellectual disabilities, autism, psychosocial disabilities, these persons find it very difficult to find a place within the job market. And this further makes the situation of financial independence a major challenge. We also see that there may be a lot of discrimination or exclusion at the workplaces. These days, we find that many corporates, many agencies are actually employing persons with disabilities. But often this may be a kind of a tokenistic employment. So they are giving a job to a person with disability just because they want to improve their CSR and things like that, without really actually giving that individual a chance to excel in the work that they have been hired for. And then, of course, you may find that within the job place, they may not be given the physical facilities, they may not be given the reasonable accommodations that we had mentioned in the previous session, and so on and so forth. So this very often leads to the workplace or the experience of the workplace being a very uncomfortable or not a happy or a positive experience for a lot of persons with disabilities. Now, we've spoken about some of these important challenges that adults with disabilities face. What then are the ways out, or what are some of the important things that we need to bear in mind, or that adults with disabilities should actually be engaging in? One of the very, very important things that we talk about is self-advocacy. So self-advocacy basically refers to standing up for yourself by speaking up and asking for what you want. Now, you may have seen that even a small child, when a baby, if a baby is hungry, it cries, it screams. It's a way of advocating for its needs. So all human beings advocate for their needs. Whenever a human being needs something, they find ways to ask for it or to demand it or to convey their need or convey their wants. Similarly, in the case of the disability sector, self-advocacy is a very, very important means by which persons with disabilities have made their voices heard globally and lobbied and come together and mobilized for their rights. What does self-advocacy mean exactly? Let's see what self-advocating actually involves. So basically, it involves asserting for your rights, interests, needs, desires, actively asking for accommodations and support, and participating in decision-making. Self-advocacy also promotes independence and self-awareness. It builds self-esteem and confidence. Self-advocacy is really one of the very, very important ways towards empowerment of persons with disabilities. So what are the various things that self-advocacy does? Firstly, it helps the individual to develop a sense of self. Many people with disabilities enter into their adulthood being told about all the things that they cannot do. This is something that they've been hearing right from the time they were children, that you can't do this, you can't study, you can't play, you can't get a job, you can't get married. So many of the things that persons with disabilities grow up with are what they're told they cannot do. But self-advocacy leads them to actually explore their own identities, explore their interests, their abilities, their capacities, so that they develop a sense of self. Also, understanding the condition is very important. So, for instance, if a person has autism and is very sensitive to loud noises or, a very disturbed environment, if they are self-advocates, they can inform or they can convey the people around them that this kind of environment is disturbing for them, and therefore they can then get relief from that disturbance. So self-advocating requires also that we understand, or the individual understands their issues and is able to communicate them through various means. Disclosing or revealing the condition is also very important. Now, learners, we have discussed it in great detail, how disability is considered as such a stigma. And a lot of people try to hide their disabilities, particularly those who may have disabilities which are not immediately visible. So they may try to hide or conceal their disabilities so that people don't look at them in a different way. But disclosure is important in self-advocacy. Only when you disclose, only when you make it clear that these are your issues and this is the support, this is the accommodation that you need, only then will you be given that accommodation. So disclosure is also an important factor to be taken in consideration when we speak about self-advocacy. Educating about rights and responsibilities is crucial. So we need to educate individuals and the community about what are the rights of persons with disabilities, what are their entitlements, what are the various duties that different agencies, different institutions in society are expected to provide for them, what are the laws that rule in favor of persons with disabilities, and so on. So it's very, very important for the community as a whole and persons with disabilities themselves to be sensitized and educated about their rights and their responsibilities of the society towards them. Also, building social connections is very important. So persons with disabilities often tend to be very isolated, but unless they build connections within the community will really not be aware of what their requirements are and how the community can assist them. And by building social connections, we refer to very, very simple things. For instance, persons in the neighborhood, the shopkeepers, the security staff, the health professionals, the dentists. So many of these service providers in our community need to be sensitized about the needs of their disabled clients or persons with disabilities who may be in their care or who may be in their contact. So by building these social connections, awareness in the community can also be enhanced. And of course, having autonomy and self-determination is very, very important. Persons with disabilities frequently are not given their voice. They are not given the ability or not given the capacity to speak for themselves. So what it is that they really want, what it is that they really need is something that we really don't give enough consideration for because others are too busy taking the decisions for them. So this is something that really needs to be questioned. This is something that really needs to be worked upon in order that adults with disabilities have their autonomy and have their sense of independence. So like I've mentioned earlier, sensitizing the community has to come together to create an environment where there are opportunities for all its members to live, work, contribute, and participate without barriers or obstacles. And having unique needs and differences should not just be accommodated, but also be valued. So to give persons with disabilities a sense of their worth and their value, give them a sense of belongingness so that they can work in the community, live their lives in the communities with a sense of dignity. Now, learners, let's talk about an issue which is very seldom spoken about, which is disability and aging. This is the fourth stage in an individual's life, and this is what the fourth unit in this particular block deals with. Now, very often we think that as a person grows old, many things happen to them. Maybe they are not able to walk very well, they cannot see very well, they cannot hear very well. We think that these are the very natural consequences of growing old. Right? So we don't really think about them as disabling conditions. We think of them as very natural aspects of growing old. But what we need to realize is that many elderly people suffer from significant disabilities as a consequence of aging. There are also persons who have been disabled earlier in their lives, who as they grow old, experience their disability in a more acute or chronic way. So therefore, there is a need to discuss disability and aging in a much more nuanced manner. Now, one of the things that you must have realized is these days people are living to a much riper old age. So people live into their 80s, many of them live into their 90s, right? So as we grow older, our bodies naturally become susceptible, or our bodies are likely to weaken with age and become vulnerable to different kinds of illnesses, chronic conditions, and also disabilities. We also find that when old age and disability are experienced together, the issues become more complicated. Also, it's important to bear in mind that the individual's socioeconomic status, health status, financial resources, gender, ethnicity, caste, geographical location all influence the experience of aging. So, for instance, a poor or an economically very, very poor Dalit woman living in a rural community is likely to experience these things far more negatively than, say, a very well-to-do male from an upper class living in an urban city with access to all the facilities. So these are also the important socio-economic differentials that we need to look at carefully. We also see that in the contemporary times, our changing family structures, the decline of the joint family, urbanization, migration are having a huge impact on the lives of elderly people, including elderly persons with disabilities. So like I've mentioned, we speak of age with disability and disability with aging. And when a person who already has pre-existing disabilities also grows older, we have what are known as late effects. That is, there are more intense or more difficult conditions that may arise as a consequence. So for instance, if a person is a wheelchair user, has been a wheelchair user from, say, their adulthood, when they become old, they may also get a lot of other kinds of conditions which are related to their wheelchair use and their old age. So these are factors that need to be considered. Mental health issues are also very, very important. So many elderly persons with disabilities suffer from a lot of sense of being useless or having a sense of, their own self-worth is diminished. They may feel neglected, they may feel rejected, and this leads to a lot of mental health issues, particularly individuals with conditions like dementia and Alzheimer's disease, which have become very common conditions in very elderly people these days. They may suffer from a lot of mental health issues, which often remain hidden, which really are not addressed or discussed. So you're familiar with the term ableism, in which persons, we tend to look at persons who are not disabled as superior in some way to those who are disabled. We also can speak of ageism. So very often we find that persons who are very old may be considered as being of no worth, of being useless, of being of no value, of being burdensome. So when ageism and ableism come together, it can lead to neglect and abandonment of elderly people. And I'm sure you must be hearing lots of newspaper reports, seeing a lot of things in the media about elderly persons who are just abandoned by their families, abandoned at the railway station, abandoned at, some religious gathering. So this is something which is a very, very unfortunate reality for our elderly, for many of our elderly people. And this is something that we need to reflect upon. Now, what are some of the important issues of elderly people, elderly disabled people? Now, there was a report on older persons with disabilities that was presented to the United Nations General Assembly in 2019. And some of the important points that this particular report addressed, we'll quickly go through these. So firstly, stigma and stereotypes that we've been discussing all throughout, the stigma about disability and also a stigma regarding old age as being something which is a phase where people are dependent and of no use anymore to the family. There are stigmas around specific types of disabilities. So I've just mentioned dementia, Alzheimer's disease, which are conditions which are very difficult for the family to deal with. And so there are a lot of kinds of beliefs and stigmas around these conditions, which can lead to neglect and abandonment of such individuals. Intellectual and psychosocial disabilities, these also are surrounded with a lot of stigma. Inequalities and discrimination, which we had also mentioned earlier, depending upon your social location, depending upon your geographical location, your gender, caste, etc. There may be many factors that may lead some persons to experience inequality, experience discrimination much more than others. Now, one of the very important things that we need to discuss is when persons with disabilities experience a loss of autonomy and legal capacity. Now, legal capacity basically refers to our legal right to take our own legal decisions. For instance, to buy a property, to sign a document, to sign a contract, and so on and so forth. But we find that in the cases of many elderly people who may be having conditions like dementia and so on, their legal capacity is taken away from them. They can no longer make their own decisions. And sometimes this may lead to exploitation of elderly persons. Often we see in the case of elderly women or widows who, after their husbands are no longer there, they may be deprived of their property. They may be forced to give away all their property, their house, etc., to their family, and then they may just be abandoned. So these kinds of cases are to be seen, even though basically our society is a society where elders are given a great deal of respect. But these kinds of situations, we do see them and we do hear about them. So sending people away to institutions, sending elderly people away to care homes. In many countries, for instance, we find that elderly persons with disabilities are forced to live in old age institutions, hospitals, nursing homes, and care homes. During the COVID-19 pandemic, it was seen that many episodes of COVID or many epidemics of COVID spread in these nursing homes. So many elderly people all suffered from COVID because there was a lack of proper facilities or a lack of proper care. So they spread the disease amongst themselves very quickly. So there may be a benefit in living in a care home, but there are also many kinds of dangers that persons with disabilities in care homes also can experience. And one of these, of course, is violence and abuse. So the risk of neglect, abuse, leaving them unattended, especially if they cannot tell what they need or they cannot articulate what are their requirements. And this kind of abuse, mind you, can happen anywhere. It can happen in the home, it can happen in the family, it can happen in hospitals, care homes, and other facilities. So violence and abuse is one of the very serious issues that elderly persons with disabilities experience. And of course, the one factor that really cuts across all age groups, and that is poverty. Poverty and lack of social protection. So they may not have pensions, they may not have social security, they may not have any means of livelihood. You may see many old people who have nobody to look after them are forced to work until they can work no more. And when they can't work anymore, then the question arises, who is going to take care of them? And this is a question that is also very pertinent in the case of elderly persons with disabilities. Now, as we've mentioned, in our context, in societies like India, elderly persons have been traditionally given a great deal of respect. They are seen as the carriers of cultural continuity. They're seen as the head of the family, and they're given a great deal of honor and care. But the impact of industrialization, urbanization, globalization has led to many of the traditional values and institutions changing. So we find that in many situations, the joint family, which used to take care of elderly people or ill people or vulnerable people, joint families are gradually declining. Youngsters are migrating to different cities, they may be even migrating abroad, and elderly people are left behind to fend for themselves. Also, elderly persons leading a retired life may also experience feelings of uselessness, powerlessness, isolation, when there is nobody really around who they feel that they can relate with, they can talk to, they can share their lives with, especially if the children have gone away. And also financial dependence that old age brings with it can have a very dehumanizing effect on individuals or elderly persons. When they feel that they are just burdens, their mental health suffers, and especially the immense medical expenses that may take place if an elderly person falls ill or becomes disabled. So these learners are some of the crucial issues that elderly persons with disabilities experience. Now, how are these to be addressed? So there is a need for accessibility, there is a need for clear-cut policies on elderly persons with disabilities, and very importantly, a change or a revision of our mindsets. Now, in this context, I'd like to mention the UN Decade of Healthy Aging, which is from the period 2021 to 2030. And I quote, "It seeks to reduce health inequities and improve the lives of older people, their families, and communities through collective action in 4 areas: changing how we think, feel, and act towards age and ageism, developing communities in ways that foster the abilities of older people, delivering person-centered integrated care and primary health services responsive to older people, and providing older people who need it with access to quality long-term care." So the points that I'd mentioned, accessibility, quality, and mindsets are very crucial. So learners, we've covered the whole journey in these 2 sessions from childhood through adolescence, adulthood, and old age. So let's sum up some of the important points that we have made in this session. So we've learned that adulthood is a crucial life stage with responsibilities like earning a livelihood, marrying, setting up a family, looking after elders, and community responsibilities. Adults with disabilities may be treated as eternal children and denied these roles. Advocacy and self-advocacy and community sensitization are essential to create an inclusive society. Old age brings its own challenges, making pre-existing disabilities more difficult to manage and occurrence of new age-related disabilities. The issues of elderly disabled persons have not received much policy attention, and changing socio-economic realities have made the situation of elderly disabled persons more difficult. However, our cultural traditions of family care and respect for the elderly must be nurtured and cultivated. Thank you for your patient listening.